Welcome! It's Ashley from Demystifying Your Health. Thank you for joining me today. We're going to be talking about mononucleosis. So I have to ask, what's the first thing that you think of when you hear that word? Let me guess, it's either teenagers or kissing, right? Yes, teenagers do have a tendency to get mononucleosis more often than other individuals. However, adults and younger children are at risk too. So kissing isn't the only way that it's transmitted. How exactly is it transmitted then? And how serious is it? And what can you do to prevent it? Let's find out. Mononucleosis is also called mono, and it's caused by the Epstein-Barr virus. And yes, it is transmitted through saliva, which is why most people associate it with kissing. However, you can get it if you share glasses or utensils with an infected individual, or if you come into contact with something that an infected individual coughs or sneezes on, because obviously when we cough or sneeze, droplets come out of our mouth and land on objects in the room that we're in. So if someone else comes along, touches something, and then touches their face, that's how they get infected. And the incubation period is somewhere between 4 to 6 weeks. So it's not as contagious though as many people believe. You're actually more likely to get the common cold than you are to get mono. And you can get it at any age. However, young children usually don't have any symptoms, and adults have already been exposed, so they have antibodies. Symptoms usually include fever, sore throat, fatigue, swollen tonsils, swollen lymph nodes in your neck or armpits, headache, skin rash, and a swollen spleen. Usually, the first couple symptoms, the fever and sore throat, they'll last the first few days. But the fatigue and the swollen tonsils and lymph nodes can actually last for several weeks. And it's important that you obviously get diagnosed with mono because there are several complications. It's hard to tell if you have a swollen spleen. Your spleen normally sits up underneath your rib cage. If it's swollen, it might actually push down a little bit. And so that's one of the things your doctor is going to check for, because obviously your spleen, if something happens to it, can cause a lot of issues. So you want to make sure you know for sure you have mono. Most people might get misdiagnosed as far as having strep throat and given antibiotics to treat that. However, because mono is caused by a virus, the antibiotics don't help. So the person doesn't get any better, their symptoms don't go any way. So if you have the symptoms of mono or strep throat and have been diagnosed with strep throat and given antibiotics, but you're not getting better, then you might have mono. So you want to go back to your doctor and make sure that you do. This way you know how to prevent complications. So let's get into those here now. Complications of mono can be very serious. One of the main concerns, obviously, is the swelling that occurs to your spleen. And this is because your spleen has a lot of blood that flows through it. It's part of your body's immune system in that it helps filter out any pathogens or bacteria or bad things inside your blood. So there's always a lot of blood going through it. And if it's swollen, it's at an increase of rupturing and causing obviously internal bleeding. So if this is the case, where if you have mono and the doctor notices that your spleen is swollen, this can actually last several weeks. So your doctor is going to usually recommend that you take it easy. You don't participate in activities or anything that could increase your chances of rupturing your spleen. Some other possible complications include hepatitis, which is inflammation of your liver, jaundice, which is when there's a backup of bilirubin in your bloodstream. Bilirubin is normally cleared by your liver, so if your liver is impacted by the mono infection, it's not going to be functioning as appropriately. So you can have a backup which causes a yellowing to your skin and sometimes the whites of your eyes. Anemia, which is obviously when you have a low blood volume. Thrombocytopenia, which is when you have a low platelet count. So this means you're at greater risk for increased bleeding, just in general, all over your body, because of the fact that you don't have enough platelets, which help your body to form blood clots. And then you can have myocarditis, which is inflammation of the heart. You can have meningitis, which is inflammation of the lining that surrounds your brain. Encephalitis, which is actual swelling to the brain. Guillain-Barré syndrome. And then extreme swelling to your tonsils, to the point where it actually gets, your tonsils are so large it cuts off your ability to breathe. So as you can see, mononucleosis, many people don't really necessarily think of it as something very serious, but it can lead to very serious complications. So that's why it's important to monitor it and make sure that if you notice anything that seems abnormal, to seek a treatment immediately for it. When it comes to treating mono, the primary focus is treating the symptoms. Obviously, it's caused by a virus, so antibiotics are not going to work on this disease because antibiotics only work on bacteria, not viruses. And there are not specific medications currently developed to treat mono itself. So in order to treat the symptoms, some key steps are to make sure that you're drinking cool but not cold water and fruit juices. This is going to help to soothe your sore throat and help prevent dehydration, which obviously is a big important component. And if it helps, you can gargle with salt water. So this will help soothe your throat. You can do it up to several times a day. Key thing is don't swallow the water. So if you're trying to make the proper ratio of salt to water, you want about 1/8 of a teaspoon of salt to every about 8 ounces of water. And then you want to eat as healthy as possible. This is obviously going to help your body heal and get over the infection sooner. Key thing is finding foods that don't irritate your throat. So think soft, bland, nutritious foods. Great ones are like smoothies because obviously you can put a lot of nutrients in there to help your body, and it's going to be cool on your throat, and obviously it's soft. So you can also take over-the-counter pain and relievers and fever reducers. So the big thing here, many of them actually are a combo, such as ibuprofen, which is Advil. It does both. Same thing with acetaminophen, which is Tylenol. And you want to get plenty of rest. Obviously, part of the whole disease process of mono is the feeling of tiredness and fatigue. And since this lasts several weeks, you're going to need to rest for a long period of time. Try to do as much as you can every day, just don't overdo it. And when it comes to activities, specifically sports, obviously for teenagers, I know a lot of them are into sports. Many of them are contact sports. Make sure you follow the doctor's advice as far as about when it's safe to resume any activity, but especially sports. And so by following all of these things, it'll help you get over mononucleosis, hopefully faster. Other big consideration is that when you have mono, your immune system is weaker than it normally is. This places you at a risk for a secondary infection that you might not normally have. So if you notice that you're having symptoms that are different from your mono symptoms, make sure you go to the doctor to get checked out to make sure you don't have something else going on as well. When it comes to preventing mono, there are a couple of things that you can do. Number one is obviously don't share food, glasses, utensils, or dishes with anyone, especially if you know they've had a recent mono infection. And practice good hand hygiene. Wash your hands frequently and thoroughly. And this means all parts of your hands with soap and water, the backs, your fingers, your thumbs, all of it. It all needs to be scrubbed. And the reason for this, obviously, if you touch a surface that someone's coughed or sneezed on, and you haven't washed your hands and then touch your face or touch something you're going to eat, then you're more likely to be infected. And it's important to note that individuals who have mono, the actual virus, even though they're feeling better, can live in their saliva for several months. So this means that if you've had mono, you want to practice doing both of these for a period of time anyway, because this is going to help you prevent spreading it to others. And if you know of someone who's had mono, make sure you're doing this around them as well, because obviously you don't want to be infected yourself. So hopefully by following these steps, you will prevent getting mono yourself or prevent spreading it to others. Hopefully now you have an understanding of what mono is, how it's transmitted, and what you can do to prevent it. If you found the information today to be valuable and helpful, please like, share, subscribe, let your friends know about us. If you have any questions or comments, I'd absolutely love to hear from you. So just put them below in the comment section, or if you want, send me a message, send me an email. Otherwise, until next time, stay healthy.